My name is Rick Mattson. I'm going to try to educate as to what's going on with Medicare and so forth, okay? We're going to kind of zip through here, jot down any questions you have, and I'll be more than happy to spend as much time as needed to go through it, okay? So, here's what we're going to try to do. We're going to try to help you understand your Medicare choices, unravel the mysteries of Medicare, and understand your options. Is anyone in the room confused about Medicare? Yeah. Part A, Part B, Part C, F plan, G plan, N plan. There's a lot of alphabet soup in there. So what is Medicare and what are your choices? How do I choose? How do I determine which is the right plan for me? And this is what I stress to people. I hear this day in and day out. Well, my neighbor has this plan. Well, your neighbor's not you, and you need to look at what's best for you. Okay, that's really, really important. Where do I buy my plan? We're going to address all these issues. Which carrier should I use? What is Medicare? Medicare is a health insurance program established in 1965. Provides health care coverage to millions of people. People age 65 and older. Is anyone else qualified for Medicare? Disabled. People who are disabled. Yep. Have to be disabled for 24 months or more. People who are in permanent kidney failure are also qualified. When can I apply? Anyone know before I go too far with this? No? Okay. 3 months before, the month of, and 3 months after your 65th birthday. Okay? First time Medicare 64 and a half and above, not currently disabled. Medicare Part A is a hospital plan. We're going to start getting into the A's and the B's, and it gets a little confusing, so bear with me. Part A is hospital insurance that helps cover inpatient care while in the hospital. It helps cover nursing facilities. Part B helps cover doctor services, hospital outpatient, helps cover some of the preventative and maintenance programs as well. Medicare Part D is a prescription program, okay? Prescription drug option run by Medicare-approved private insurance companies. Part A and Part B comes from the federal government. Do you pay for Part B? Yes. Do you pay for Part A? No. Correct. Helps cover the cost of prescriptions. Back to the Medicare Part D, may help lower prescription drug costs and protect against higher costs in the future. They want everyone to be enrolled in a Part D program as well as Part A and Part B. Learn more about Medicare, you can go to Medicare Advantage programs at medicare.gov. Original Medicare, Part A, Part B, we just talked about those two. Original Medicare, and you'll hear people refer to Medigap insurance or supplement plans, okay? Part A, Part B, and Part D, that's what people tend to gravitate to. Medicare Advantage program is a different animal completely. It says it's Part C. I don't know how they skipped A and B, went to D for the prescription and came back to C for this, but Medicare Advantage program encompasses Part A, Part B, usually combines Part D as well, so it's one plan that covers all three, and there is an optional Part D plan. Cannot join Medicare Advantage program with a Medicare supplement or a Medigap policy. Can only have one or the other. Medicare Part A, automatic enrollment. If you are receiving a Social Security check, or when you turn 65, you will start receiving your Social Security check, you will automatically be sent a card for Medicare. It'll have your Part A and your Part B. Has anyone received one of those automatically? Okay, a couple of you. Now, question comes up. I'm still working. I don't want to pay for Part B. Send the card back, tell them you just want to sign up for Part A. Okay? Part A is free, Part B costs money. Inpatient hospital room and board, skilled nursing facilities. Notice in parentheses it says it's not long-term care. Many people believe that Medicare Part A and Part B will cover you in a long-term care facility. It absolutely will not. Hospice and respite care services. Anyone who ends up on that basically has 6 months to live if you're on hospice, and that's you would convert back whatever plan you had, you would convert back to original Medicare. Okay? Some health care services are covered as well. Blood is covered up to the first 3 pints, I believe. Here's some eye-opening facts. Your hospital deductible, day 1 through 60, $1,288. That's coming out of your pocket. Okay? 61 through 90, $322. 91 through 150, $644. After 150, there's no coverage whatsoever. Okay? You bear the whole cost. Skilled nursing facilities, minimum of 3-day hospital stay to get put into a skilled nursing facility. Days 1 through 20 are covered, 21 to 100, $161 a day cost you out of your pocket. Hospice care, we talked about that just recently. Blood, first 3 pints are usually covered. All right, Medicare Part B medical. You can delay your Part B enrollment if you have employee coverage and if the prescription coverage is deemed credible. Okay, we'll touch upon that later. Monthly premium for anyone turning 65 this year is $121.80, and it's income dependent. The least is $121.80. It goes up to over $400, depending on your income. Enroll 3 months prior to 65, 3 months after, and the date of. So they give you plenty of time to get in for your initial enrollment. They give you basically a 7-month period. Medicare Part B coverage, doctor services, outpatient care. Welcome to Medicare Visit. This is one unutilized section here. When you turn 65, you're entitled to a Welcome to Medicare Visit. You go see your doctor, and he does a complete physical and a workup on you. It doesn't cost you a dime. Preventative services, flu shots and so forth are covered. Ambulance services are covered. Cancer screenings and chemo are covered. Diabetes screenings and supplies are covered. Durable medical equipment. Limited chiropractic. Very little vision, very little hearing as well in original Medicare. And what I mean by very little is if you go to an eye surgeon for an eye exam, that would be covered. If you went to, I'll use Sears or Walmart, and you want to get an eye exam, it's not covered. You have to go to a surgeon. You have to go to a medical doctor. Okay? Outpatient lab fees. Out-of-pocket cost, $121 a month deducted from your Social Security check. Deductible per year, your first $166 of Part B, you're going to have to pay $166 out of pocket. Co-insurance, a lot of people aren't aware of this. Medicare Part A and Part B covers 80%. You are responsible for the other 20%. Okay? So, hypothetical, you end up in the hospital, $100,000 bill, Medicare pay 80, you're going to pay 20. Okay? This is a nice little tool here. It's in your pamphlet, Medicare Part A, Part B. Basically tells you what's covered, what's not, what you pay. I really like the way it breaks it down, and it's pretty straightforward. After enrollments, Part A and Part B, guaranteed acceptance. In the state of Connecticut, there are no pre-existing conditions. There are no underwriting rules. Other states have underwriting rules. There are none in Connecticut. Can get Connecticut with a Medicare Advantage program as well. Can get a standalone prescription program, so you can get Part A, Part B, and a prescription program. Or you can get a Medicare Advantage, or you can get, am I confusing you yet? Or you can get supplement programs. So there's a lot of different ways you can go. Here's something, again, that people don't understand. Many people, you may pay a penalty if you're not enrolled when you're first eligible. Remember I said you 3 months before, the month of, and 3 months after? If you don't sign up for Part B, you will be hit with a 10% surcharge. Okay? On a prescription program, if you don't sign up for a prescription program, whether it's through a Medicare Advantage program or a standalone Part D program, you will be fined 1% each and every month until you do. Okay? Once you do, that's when that fine will be assessed. I met with an 87-year-old woman. She had Medicare Part A and Part B, never anything else. She takes 1 prescription a month. Prednisone, she says, it cost me $4. I've never signed up for Medicare Part D. They fined her 1,000% extra. I appealed it. We got it taken off. But they wanted to charge her 1,000% more than what that plan should have cost. So it's important. Anyone know the logic behind getting signed up for Part D? Anybody? No? Okay. Medicare says we need everyone to participate to help keep the costs down. And it's true. All right, can get Connecticut In Connecticut, you can get a Medicare Savings Program, or you may hear it referred to as an MSP program. That's for people who are on limited incomes. As you can see, a single person making less than $2,088 can actually get that $121.80 paid for, that Medicare Part B, and it will help with co-pays and anything like that. For a couple, it's $24.35, and you can see it goes up as we go along. Must select a private drug plan, okay? When you're looking at getting a prescription program, whether it's through Medicare Advantage or standalone, one of the things you'll find very important, you want to give whoever you're working with a complete list of the prescriptions that you take. When you how many you take a month, okay, where you get them. It's really important, and there's a paper in your pamphlet there that lists the prescriptions. You just fill it out, give it to whoever you're working with. They should go on to CMS.com and run an independent analysis for you and tell you what programs in your areas are best for you. One of the things people don't understand is prescription programs, Medicare Advantage programs, supplement programs are all done by where you live, what state and what county. Example, there are some plans that are available in New London County. If you go to Windham County, they may not be available. So it's done by state and then county. So those are things you all want to look at. Okay. Premiums vary based upon which plan you basically choose and what company. Some plans have deductibles up to $360 a year, and some plans have zero deductibles when it comes to prescriptions. So you really have to look at what's going to work best for you. Anyone ever hear of the donut hole? Most people have. It's very, very confusing. I get confused at times. The donut hole or coverage gap has an annual out-of-pocket that exceeds, when your prescriptions exceed $3,310, you go into what's called the donut hole. Now to get there, it's whatever that drug cost will help put you into that donut hole. To get out, and you have to go up to spend $4,850 out of your own pocket, you only get credit for what you pay to get out. So it kind of goes a double-edged sword, unfortunately. Catastrophic coverage, once you reach catastrophic coverage for your prescription programs, there are small co-pays. They're like $240 and $660 once you get out of the catastrophic coverage. Okay? About Medicare Part C. Anyone know what Part C is? Guys aren't taking good notes. We already talked about it. Part C is a Medicare Advantage program. You can join plans only during certain times of the year. Let me back up. When you first turn 65, you have 3 months before the month of, and 3 months before the month of and 3 months after. So you have a 7-month window. Every year there's an annual open enrollment period which runs from October 15th to December 15th. Or October 7th to December 15th. Every single year. If you're in a Medicare Advantage program and you don't like it, you can change at that time. It'll take effect January 1st. Supplement programs you can change anytime you want. Prescription programs go by the open enrollment rule like a Medicare Advantage program. Okay. When you're looking at a Medicare Part C, or it has to at least cover what Medicare covers. A lot of the times the Medicare Advantage programs will cover things that Medicare does not cover. I give you an example. As we get older, our hearing tends to go. I'm having problems with my left ear right now. Medicare does not pay for hearing aids. Some Medicare Advantage programs do. So again, you have to look, see what I mean? You have to kind of look and see what's best for you, whether it's an Advantage program, a supplement program, or whatever. Maximum out of pocket per year can vary on a Medicare Advantage program. Some can go up as high as $10,000. What we find in the state of Connecticut, it's right around $6,700 on a Medicare Advantage program. Between co-pays, deductibles, and so forth, on a Medicare Advantage program, max out of pocket would be about $6,700, $6,800. Some plans have certain rules to follow, like referrals. Your Medicare Advantage programs, you do sometimes have to get referrals, or at a minimum, you have to stick to a network. You may have to use providers who use to the plan, sticking to a network. Insurers can opt out of these plans at any time. I had a client call the other day, said, Rick, my doctor I've been going to for 20 years dropped the Medicare Advantage program I have. What do I do? I said, you have to find a new doctor, unfortunately. Doctors can opt out of these plans at any time. Hospitals can opt out of these plans at every time as well. Believe it or not, there's one of the important questions you want to get answered. Is L&M, if you live here, do you go to L&M or Westerly? Are they all in the network? Is Yale New Haven in the network? Is Hartford Hospital, some of the elite hospitals in the state, are they on your network? We talked about this earlier. You cannot own a Medicare supplement program and an Advantage program together. Here's what would happen. Let's say you have Medicare Part A, Part B, and you have an independent standalone prescription program, and you sign up for a Medicare Advantage program. Here's what will happen. Social Security will cancel your Part D, and you will be reverted back you would go to the Medicare Advantage program. So you can't have two at the same time, and it would bump you out of any supplement that you had, okay? They watch it like a hawk. Plans available to help people in their gap. Remember we talked about that donut hole and so forth? There are programs, Medicare Advantage programs, that will help you in that gap, okay? Which can be quite pricey. Here we go. There's the alphabet soup. Each one is a little bit different. There are a couple plans on there that only people under 65 can get, and the rest are all available to everyone. Plan F is the most comprehensive. I put some information in there on Plan F as to what it covers. When I say it's the most comprehensive, it's also the most expensive. Okay? All med subs are guaranteed renewable, flexible, and freedom to choose. Remember we said with the Medicare Advantage program, you have to stick to a network? With these, any doctor, no referrals, go wherever you want, as long as they take Medicare. Any doctor, any hospital, any specialist, no referrals needed, no networks, okay? All companies must follow federal and state laws. Get this question all the time. Well, Plan F, I see them starting at $220, I see them going up to $480. What's the difference? Anybody know? Just the carrier. If someone's charging $480 versus $221, I can tell you right now that carrier doesn't want to sell that plan in the state of Connecticut, because every Plan F has to cover exactly the same for every single carrier. So remember I said by state, by county, that's how it's determined. So they all have to be exactly the same. How Medicare supplement plans are priced. I did put a sheet in there on the state of Connecticut pricing for Medicare supplement programs. That's the most current sheet that came out, I believe, last month or 2 months ago. How Medicare plans are priced. All ages are priced the same. Everybody pays the same premium. Medicare plans in the state name, community age, we talked about that. Everyone pays the same. Sex distinct. In the state of Connecticut, there's no difference for male or female. There's no difference on tobacco either, okay? Rate adjustments, you'll see rate adjustments every single year on Medicare Advantage programs and supplement programs. It's up to the individual carriers whether they do a price increase or not. The reason they give us is rising Medicare claim trends, changes in annual deductibles. Medicare supplement programs are guaranteed issue qualifiers. Okay, here's what's real important. To get a Medicare Advantage program or a Medicare supplement program, you must be enrolled Part A, Part B. If you do not have plans Part A and Part B, you do not get you're not eligible to sign up for anything else. Cannot be denied during open enrollment. And again, in the state of Connecticut, there's no denials, there's no underwriting at all. No underwriting in the state of Connecticut. There it is. Pre-enrollment is October 1 to October 14th. Open enrollment periods, I made a mistake. It's October, I reversed the 2 dates. October 15th to December 7th is open enrollment every year. Annual disenrollment period is January 1 through February 14th. How do people save money on types of health insurance? This kind of refers to the Plan F plan. How can I save money on a Plan F plan if it's most comprehensive? Just like you do on your car or auto insurance. You look for, you raise your deductible, okay? Here's an example. Plan F, Plan HDF cover the same exact things with one exception. Calendar year deductible out-of-pocket cost on a high deductible Plan F is $2,180 of the 20%. Remember, Medicare pays 80, supplement plan pays 20%. What they're saying here, if you're healthy and you want the best coverage there is, you can get a high deductible Plan F, pay the first $2,100 out of pocket, and most of my clients who are in that type of a plan never reach that, okay? And you'll see why. There's a big price difference in the two. Here's an example, okay? Total approved Part B, doctor claim, $100. Medicare pays 80%. Customer pays 20% or $20. Once that $2,180 deductible is covered, you have 100% coverage, just like on a Plan F, at a fraction of the price. Here's how a husband and wife work. I use the lowest priced one in the state of Connecticut, $221 for a Plan F, $58 for a high deductible Plan F, saving $163 a month times 12, $1,956 a year, or $3,912 savings a year. Okay? Only good if you're healthy. Okay? If you do it over a 10-year period, you can save a combined savings of approximately $39,000. Okay? People say to me, well, that $2,180, maybe I don't have the $2,180 to take care of and so forth. There is such an animal, it's a reserve fund annuity. It pays 3% interest, okay, which is better than most banks. You can put money into this reserve fund annuity, and you can pull the money out at any time with no penalty to help pay for that $2,180. Okay, the interest rate is guaranteed. There's no lock-in time. Minimum $50 deposit to start. No startup costs, no surrender fees, no commissions or loads. Can be purchased along with the Medicare Supplement Part A, B, HDF, G, K, and L. Boy, the alphabet soup. All right, which plan is right for me? If you're turning 65 years, you have a one-time open enrollment period, which they've talked about so many times here. The decision to make today affects your quality care tomorrow. Okay? Which plan is right for me? Do you want flexibility, freedom to choose your own doctors? If that's a yes. Do you want to choose your own specialist without referrals? Yeah, probably. Do you want to choose the best cancer treatment facilities available? I would think you would. Do you want to pay a lower premium to save money? Maybe. Do you want the flexibility, security, and stability of a guaranteed renewable Medicare policy? Yes. Do you want the plan to include foreign travel? A lot of seniors do travel, so maybe that's something you want. I'm not sure what my health will be in 3 to 5 years from now. Should I consider a low-cost plan and switch to a better plan down the road? Maybe. Okay. Remember, if you buy a supplement program, you can change anytime you want. Anytime you want. Okay. Do your homework. Choose a local agent. I stress that. Choose somebody that works local, because if you have a problem, it's nice to be able to go to their office and say help. Okay. It happens more than you think. Ask about their qualifications and designations. That's something you want to do. Ask how long they've been selling insurance and Medicare products. That's a good question. Ask how long they've been licensed agents. That's another good question. Why choosing a carrier is important. Remember I said all carriers have to provide supplement programs to be the exact same thing? Here's something you want to look at. You want to look at their financials. Why is an A+ superior rating important to me? How long has the carrier been in the med-supp business? These are questions you want to ask. Why choosing a carrier is important. How quickly do they issue policies and pay claims? That's huge. You want your claims paid quickly. Do they outsource their customer service call centers in the United States or outside of the United States? Another major consideration.